It's a narrative review on the roles of nursing in sexual dysfunction among oncologic patients with some updated recommendation. And I hope that I can bring you some very useful practical points that you can take home after this conference. I'm Patricia Tai, the third author in this work. The other collaborators are Suhair Al-Garfish. She's also from the Al Sutuna University. And Mr. Calvin Wong is very much focused on prostate cancer. He obviously is very interested in sexual dysfunction. Professor Kieran Joseph works in Canada, Edmonton, the very famous Cross Cancer Center. And Professor Edward Yu is actually my own teacher when I was in residency training. So next slide, please. We declare no conflict of interest. Next slide. So this work has already been published in Current Oncology with impact factor about 3.3 and it's a Q2 journal. Next slide. Let me explain to you who is Mr. Omar Agaisi. He's actually a nurse that works in Jordan in the military cancer center there. He's also a clinical instructor part-time in Al Sutuna University. He holds a master's degree in emergency and disaster medicine. He actually have a lot of experience using the preferred reporting items for systematic reviews and meta-analysis. The very short abbreviation is PRISMA. And also the MMAT, also very famous abbreviation, makes Mathews appraisal tool for research. And his recent research actually have many, many areas, although he really have a lot of interest on sexual health. He also works on pain control, patient satisfaction, sleep quality, and so on. And I myself is his collaborator or mentor. I'm a clinical oncologist by training. That means I have expertise both on radiation and medical oncology. And my expertise is on skin and prostate cancer. I'm an up-to-date author on skin cancer. Like there are 5 chapters from me. So you will hear me talk about Merkel cell carcinoma later on today. Next slide, please. So sexual dysfunction is a very common untreated medical issue and people are afraid to talk about it. And however, it's so important because it negatively affects their quality of life, the emotional wellness, and also the relationship intimacy. And this is a part of our published projects. There are altogether 3 papers published so far, and we are writing more papers focusing on CNS patients, on melanoma patients, because each cancer have their own specifics. And that would be a more in-depth analysis of the situation. So those studies actually show that sexual dysfunction is such a prevalent problem. It's happened in 60% of cancer survivors. And so you would be very interested to know how to tackle it in your daily clinical work, whether you are a nurse or a doctor or social worker. Next slide. So Proctor, he found that 57.5% of cancer survivors have different kinds of sexual dysfunction and it's similar prevalence among men and women, and therefore the burden of sexual dysfunction is huge. Next slide. This This narrative review aims to explore the existing literature on the roles of nurses in identifying to manage sexual dysfunction among cancer patients. We all know that chemotherapy, radiotherapy, surgery, and hormonal therapy lead to many different problems in sexual function. It could be like it block the arousal. It could be the male erectile impotence. It could be dyspareunia. That's the medical term for the pain during sex for female. This could be from vaginal fibrosis from radiation, or it could be the vagina is like sort of shortened by surgery and therefore make the penile penetration very painful. It's different ways. And you know that a lot of pelvic surgery and radiation actually affect the nerve. And therefore, the sort of sensation during sexual intercourse is really greatly impacted. Next slide, please. So Mr. Omar Gaisi searched across 4 major electronic databases. They are the Scopus, the Science Direct, Medline, and also Sinho. It's actually University of Arizona had purchased, I guess, this, and it's not available in many other universities. So you could appreciate that it has been a big advantage to work in Jordan with this availability. And then the data analysis I'm going to show you in the following slide. Next. So let me summarize it. Prevalence and impact. I've already told you that it's important. There is psychological and social impact. There is intervention, that you can do something. And we suggest training programs to achieve holistic cancer care. Now, how to deal with the nurse attitude and beliefs. This actually would be another detailed talk today in the form of a scoping review that I will give later, a few hours later. And then we would also talk about global efforts, how to get sexual health education coming to different professionals in healthcare. Next slide. Now, the prevalence and impact of sexual dysfunction. This global burden of cancer is rising. There are 19 million new cases and 10 million cancer-related deaths reported in 2020. Because the data lags behind, although we are now at the end of 2025, they have to verify the data. They have to make sure everything is accurate before they announce it. So you won't be able to see any of even the 2024 data. Okay, so that's why don't think that I'm old-fashioned, give you those 2020 data, because WHO and all these organizations are slow. Okay, they want to check everything is right before formal announcement. So in 2022, they find that the survival rates for many cancers have improved, and people live longer, and therefore they survive to face the survivorship issues like sexual dysfunction. And the prevalence of sexual dysfunction among cancer patients depend on the specific cancers and what sort of treatment they have received, the age, the comorbidity, and gender. Next slide. The need for comprehensive psychosocial support is rising, and we all can contribute to help patients to out of the vicious cycle because they have diminished self-perception. They have a poor self-image, particularly in mastectomy patients, and they have feelings of isolation, and therefore it intensifies their emotional distress. Well, it is really very disturbing to to see that these patients face physical challenges. And we would like to improve this very important aspect of quality of life to be able to give a holistic cancer care. Next slide. So there are many barriers to address sexual dysfunction. Uh, the caregiver themselves feel that it's a cultural taboo. They are shy to talk about it. They are afraid that they break the silence and they don't know how to lead the patient. Uh, they are afraid that some conservative patient may complain that why did the nurse bring up such very sensitive, personal, private matters in front of me? So all these would need to have some reform at the organization level. The nurse need to have special training. They need to relieve their own personal anxiety about sex. Next slide. So the treatment approaches for cancer patients, how to address all these will be by training programs. They find that actually is like role play is very useful. So they can sort of take history with a standardized format, and they should be having some training or skills so they can talk about sex in an impartial manner, that you are not pointing finger who is right and who is wrong. We need also to have multidisciplinary collaboration. We need pharmacists to help. Next slide. So, how to deal with the nurse or even doctor's own attitude and anxiety and a belief about sexual health? Well, it depends on the culture, obviously. For example, if it's in conservative societies like the Islamic countries, like China, or even Taiwan. So it's not easy thing. There could be patient misconceptions. So there are so many issues about it. And some patients feel that they're uncomfortable. They may be a little bit more open to talk to nurse of the same sex. So that means a male patient will talk to a male nurse, a female patient talk to a female nurse. Next slide. So recent years, we have witnessed a growing global recognition of this unmet need. And in United States and Canada, there have been different programs. Like in big cancer centers, they have such programs. In Canada, the True North Sexual Health and Rehabilitation is a e-training program for prostate cancer patients. So it actually helped in improving the knowledge and self-efficacy, and 98% of the attendants really love it. Next slide. So, in conclusion, sexual dysfunction and education is very important. It significantly impacts patients' sexual health, emotional, physical well-being. We have lots and lots of barriers like lack of training, the cultural stigma, institutional constraint. It might be constraints of time. You know, who has the time to talk about something extra called sex? If you think about it. And the nurses are already busy enough. They don't have enough sleep. In some countries, the nurse don't have enough time to go to bathroom themselves. No time to eat their own lunch. Who has the time to talk about sex? That is called institutional reform. There should be protocol. There should be time set. We should empower nurses by having structural education, standardized guidelines, and open communication strategies. All these are important to improve the outcome of sexual health of cancer patients. And don't think that it's just a breast, a prostate, a testicular cancer, or bladder cancer patients have sexual issues. Almost all patients, after chemotherapy, immunotherapy, radiotherapy, surgery, they have some sort, different kind. Imagine a patient have a huge lymph node in the neck. After node dissection, the scarring make the lady feel themselves unattractive. They want to cover up their neck with some scarves. They feel embarrassed to undress in front of their own husbands. Next slide. More conclusions. So this study is special because it's from a team of Middle Eastern and Chinese researchers. I'm Chinese in birth, okay? And I received my own medical education in Hong Kong, a British colony, and subsequently moved to Canada. So I'm getting more open to talk about sex than most other Chinese ladies. They are conservative traditions. You may not even be aware that in Middle East Islamic countries, the female had to be accompanied by male family member to go to medical clinic. Not to mention to undress themselves with the male, it might be their father that they feel uncomfortable to undress, to show their breast lump or to even talk about sexual problem in front of the male family members. They could be just too shy to open up. So in the narrative review, which I hope that you will read in detail, this current oncology paper is open access. All you need to do is to get to current oncology and search for Omar Agaisi or my name, Patricia Tai, and you would be able to locate it. It's published this year in spring. So the spring issues, you would be able to find it. And I hope that this concise talk would be able to be a unique, highly educational resource for healthcare professionals across many different disciplines. It could be nurses, doctors, social workers, psychologists, music therapists, sex therapists, even chaplains. Next slide. So I would like to acknowledge at this time to many collaborators from the International Oncology Cooperative Research Group, particularly Professor Kieran Joseph, Mr. Calvin Wong, Professor Albert Yu. Next slide. And you could send email questions to Mr. Omar Agaisi, who happened to be at work today and is out of his control. And I hope you don't mind that I present on his behalf. I am his collaborators and I worked a lot to publish this paper. Thank you.